So today we are going to go over how to perform a nutrition-focused physical examination in which the purpose is to look for malnutrition, risk, muscle wasting, weight loss, and micronutrient deficiencies. Before you approach the room, you want to use patient identifiers to make sure you're speaking with the correct patient. Start with introducing yourself to the patient and making sure that they are comfortable with the examination. Also go over the cause and reason for the examination. Hands should always be washed before and after, and gloves should be worn no matter what. So for the head and neck region, we are going to use 1 centimeter palpations as opposed to 4 centimeters that might be used for the rest of the body. So you're going to start with asking the patient to look at you head on and have them turn side to side. So for this, we are looking at the temporalis region, looking for muscle wasting. It'll be right here. And you're looking for slight depressions versus a hollowing and scooping depression. Next, we're going to move to the orbital fat pads, and you're going to want to make sure that the patient knows that you're going for the eye region. So ask them to close their eyes and gently press underneath the eye. If subcutaneous fat is present, it should bounce back at you. Next, after that, we are going to move straight into the cheekbone area. And you just want to look for any protruding or any abnormalities. Then after this, you want to have the patient close their eyes again, and you're going to look for any sunken eye regions, any dark circles, loose skin, or any prominent brow bone features. After that, you want to also check this chin for any protruding neck or any sunkenness that's underneath. Then lastly, you want to check the eyes for jaundice, which is any yellowness in the eyes, and the tongue and gums for any discoloration or abnormalities. You also want to make sure that they have their teeth in, or if they have dentures, any cracked teeth, missing teeth, anything that could hinder their PO intake. And after that, you just want to check for any cracks in the lips, dry lips, and overall dry skin.
Portion of this video will go below the neck. First, you start at the clavicle bone. You want to gently press behind, looking for the muscle behind there, and then follow the bone out to the acromion region, which will be right at the shoulder, the end of the bone here. You want to look at the deltoid, which is the shoulder muscle, and make sure that it's rounded, which indicates a healthy individual, whereas if it was pointed or squared, that would indicate malnutrition. Then you want to ask the patient to lift their arm up at a 90-degree angle and hold their wrist. Then you'll go underneath the tricep region and pinch the skin. When you're pinching the skin here, a bigger pinch indicates a healthier individual. Make sure you're just getting the skin, not the muscle. And if there's a small area to pinch here, that would indicate malnutrition. Next, we're going to go down the arm, checking for any abnormalities to the hands, and looking at the interosseous muscles, which is the muscles in between the bones of the hands. Then you're going to ask the patient to make an OK sign, and you'll be looking for a muscle bulge right at the bottom of the OK sign. Next, you'll go to the nails, where you look at the nail beds and check for any concavity or thinness of the nails. And that concludes this portion.
For the next portion of this video, we are going to be looking at the patient's back. We're going to be starting at the top of her shoulders, and we're going to be looking at the scapular bone region. This region should be covered in muscle. The muscle helps protect the bones in this area. So if you were to see a hollowing here or a depression here, that would indicate malnutrition. Continuing on, we're going to examine the muscles in the back, this trapezius region here, the latissimus dorsi, and the supraspinous and infraspinous muscles in the back. You're going to be checking for the spinal cord, a protrusion of the regions of the spinal cord, and checking for the areas near the ribs. You would see depressions in between each rib. Now I'm going to have the patient raise her arm, and we're going to look at the mid-oxillary line, the posterior oxillary line, and the anterior oxillary line, looking for depressions or hollowing here. This region here is commonly known as the love handle, and this is going to be the iliac crest. You would see a obvious protrusion in a malnourished person. And while we have this view, we're going to also check front part of the ribs for any depressions, and the abdomens for the 4 quadrants of the abdomen.
So the next portion of this video is looking at the legs. As Lindsay previously mentioned, you're going to be looking at the iliac crest, also known as your love handles, and you're going to be looking for any kind of protruding bone. After this, you're going to be moving to the thigh. So you're going to ask the patient to bend their knee up and then look for any kind of concavity in the thigh. And this is a sign of malnutrition. In obese patients, you will also see some kind of concavity in the inner thigh as well, and as mentioned before, it's a sign of malnutrition as well. Then you will be moving to the quads, which is on top. So you are going to be grasping the top of the quad and feeling for any kind of muscle loss. Then you're going to be moving down to the patella region, also known as like the knee region. And you're going to be looking for any kind of protruding bone, as well as any muscle loss around the bone. Then you'll be moving down to the calf region, also known as the gastrocnemius, and you will be grasping the calf muscle and looking for any kind of thinness and any kind of muscle loss or muscle definition loss as well.
For the last portion of this physical examination, we wanted to point out that throughout the entire assessment, you should be checking your patient's skin for dry and scaly areas, for color and pigmentation, for jaundice. You want to check the turgor of the skin, make sure that it's intact. And also you want to be mindful of edema. Edema is mostly prominent in the hands and ankles, lower and upper extremities, as well as under the eye socket.